Welcome to the Everything But Real Estate podcast. I am your host, Arturo Cruz. Today we have two remarkable guests with us. First, we have Dr. Lynda Dinduro, a pioneer in holistic pediatric dentistry inspired by a transformative experience with a dentist in her native of Nigeria. Dr. Lynda pursued her passion for dentistry through rigorous education and training. She holds degrees and certifications for the University of Benin, Howard University Hospital, and Children's National Medical Center. Also, with us, we have her beautiful daughter, Dr. Krystal Dinduro. Dr. Krystal followed in her mother's footsteps, inspired by her work and dedication. She earned her bachelor's degree from Columbia University and her doctorate from Virginia Commonwealth University, VCU, completing her pediatric residency in Brooklyn, New York. Together, Dr. Lynda and Dr. Krystal are transforming children's dental health for the last 20-some years. Welcome to the show. How are you today?
Quite well, quite
Thank
well.
you for
Thank
having
you for
us.
having us.
You know, it's amazing. We met 20-some years ago.
Absolutely.
And you're still knocking them, just doing everything positive for the community. So we're so blessed that you're here with us today. Share us a little bit about your backgrounds and how did you get into into dentistry, please?
Oh, well, thank you so much. It's a great question. As you said, we're both we're a mother-daughter duo, and every day we wake up trying to unlock the God-given potential for every child we meet. So as pediatric dentists, we're generally looking to better their health and by making sure they're growing well, sleeping well, and breathing well so they could be their best selves. So
That's so important that a lot of stuff you do really creates a lot of good health for the kids, right?
absolutely, absolutely.
How about you?
As far as how I got into and
Yeah, how
how
did you
this
get?
became,
Yeah,
well, I was a dental assistant first at 16 years old.
really?
So I couldn't work at I couldn't work at the mall.
Okay.
Wasn't allowed to. And so the next best place was working at the dental office. And
Okay.
so from there, that was how I was able to interact with kids, kind of get to understand what the dental environment was about and what healing and caring for children was about. And so that really started to inspire me. At first, I thought, oh, it's just the mouth, it's boring. And then
Right.
over time and being able to see
Change everything, right?
it changed, right? Completely changed. It's you're working with actual children and being able to impact their health and interact with them and and just see their personalities. They actually help you stay young too, as well. So that was where it all started for me.
Fantastic. Dr. Linda, we did a little bit of research on you, right? So you knew you wanted to be a dentist since you were 8 years old. Tell us a little bit about that experience.
Oh, that's amazing that you found that out. I'm the first of 9 children, 8 surviving. And when I was about 8 years old, one of my younger brothers had a toothache, very, very severe toothache. And where I come from originally, there are not a lot of tooth disease, tooth decay. You had
Okay.
more like malaria was endemic.
Okay.
And so when he had a toothache and he was in pain, he could not sleep. So he would not let anyone else carry him but me. So he wasn't sleeping, I wasn't sleeping.
Right.
I was a good student, and I always thought I would be a doctor. Finally, when we got him to the dentist and she took that tooth out, he was like a different kid immediately. So I said to her, what do you do to be this kind of doctor?
Right, right.
And so she said, oh, it's difficult, it's this, it's that. I said, that's the kind of doctor I want to be. I don't want anybody else, any other kid to have to go through the kind of pain my brother had gone through. So that's how it came about.
And that's a testament because both of my kids went to your practice
I just-
20 some years ago, and and we loved it. We loved it. They really take care of the kids, no doubt about that. Dr. Krystal, how did your mother influence and your own experiences shape your path into pediatric dentistry?
Yes, that's an amazing question because, to be honest, I've always wanted to be in healthcare
Okay.
since I was 8 years old. I always wanted to work with kids, but I wanted to be a surgeon and help them in that way. And so
A
as
surgeon.
yeah, a pediatric surgeon, and
Okay.
I shadowed one and everything, and I thought it was the most amazing thing. But like I told you, I worked as a dental assistant. So at
Yes.
16,
Right.
that's really when I was starting to see what, working in healthcare was all about. And I could tell every time, my mom sang to the patients. I learned to sing to the patients. She was able to just have kids who came in so anxious about the dental world or about dentistry leave so happy. And still working with her, these years later, the kids haven't left. They're
Yeah.
adults now,
Yeah. Yeah.
and their memories are still positive. And so that I seen that as seen that as a teenager. I knew that's what I wanted to do. I wanted to be able to have a great impact on children because I know it's going to last. These kinds of memories last and last, and you get to see their personalities change along with helping them be better and understand about their health. So
Yeah.
that was where the impact lies.
And that's the one thing that I saw when I brought my kids is like they were the caring part
Yes.
of you and everyone that worked at the practice, right? That was very important. I'm sure that was probably one of your mission statements and one of the things that you really deliver to through your staff and obviously to the people that you service. So definitely saw that. So along those lines, tell us about some of the success stories from your past clients. Some screaming kid or something like that, right? That or some other
They're
positive
not
stuff.
screaming, they're singing.
They're singing. Is that what we
yeah,
talking about?
Singers
they're
in
singing.
our
They sing, they don't cry or scream. I would have to say there's so many of them over the years. We've been open since the year 2000. And I would have to claim the fact that your kids, Sarah and Andy, haven't had cavities and in
That's
their
right.
20s. I feel good. I feel like we gave them a good foundation
fluoride,
to
right?
start. A good foundation to start, so they're taking good care of their teeth as well. And however, we do have so many successes. A couple of them come to mind. One that is really always dear to my heart when I think of it is Jojo. And his mom doesn't mind us telling this story. And he was referred to, he's a special healthcare needs patient. He was referred to us when he was 9 years old. And when he came in, he wouldn't even come to the back. He would stay in the reception and singing as loud as he could, as loud as he could. And we'll come, we'll play a little bit, give him prizes, and then he would go. And why this is so important for me and maybe for the people who are listening is that when you're a parent with a special healthcare needs child, you're not only worrying for the child, you're worrying for how are people looking at you. And sometimes you even just accept and go, oh, my child is just who they are. Then, that's who God gave me. And we want to change that narrative because we want parents, first of all, feel okay. You're in a kid's place. It's a safe place. So however your kid is okay, is perfectly fine as far as we're concerned. And for your kid, we see there's a God-given potential in them that we're going to help uncover for you.
100%.
And a lot of times it involves having to help them to breathe better because most of them are breathing through their mouth. And when you're breathing through your mouth, your body's not getting good oxygenation. If your body's not getting good oxygenation, your brain cannot be working at its best. So anyhow, back to Jojo. So over the years, we've treated Jojo. We've been able to help him have his lips together and breathe through his nose. Because when he came, his teeth were like way far out there, and so really bucked. We've had him breathing better. His lips are now closed all the time. He's got finishing up an Invisalign. He's got a great smile, and he's 16 now. He even has a girlfriend.
No kidding.
But
Okay.
no, not
Okay.
kidding at all. And so he's more verbal. He's more expressive. So just seeing that we were able to get more out of whatever his mom ever expected of him is very rewarding. Of course, it wasn't just us. There were other healthcare providers that we work with. But again, if you're not breathing properly, if you're breathing through your mouth, and then your brain cannot be optimal. So that was a big foundation to how he got better. So
That's amazing.
that's one that comes to mind right away.
So, Dr. Crystal, your mom's got this. That was an amazing story, by the way. Thank you so much for sharing that, Dr. Crystal. Tell us a little bit more about that. We know we sort of went off camera, talk a little bit about your experience, but please tell us.
Oh, well, for me, the stories, I think they all kind of come together. I don't really have one particular one that I can recall, but what I do recall, what I do remember is how oftentimes kids will come in just very, very anxious, extremely anxious. Some of it we know, when they've got the high anxiety and a few appointments, we know, okay, we're sharing a space. This is something that we start to understand. We're sharing an airway space with them. And so for many, that does cause anxiety because it's like they themselves already have a hard time sitting still and understanding their world. And then now you're coming in there with instruments and all types of things. So it's just remembering the kids that come in so anxious and we're able to get to their level
Right?
and help them just get through and help them. Some things are hard, right? And being able to talk to children are very, very, very intelligent. So being able to talk to them, meet them at their level, um, a lot of times allays their anxieties. A lot of times, knowing that they have someone on their side, they typically do a really good job. So I just remember all the patients that I'm able to just chill with and not make it a big deal, even though it's a big deal for them, but it is something that has to get done because I know I have a job to do for them. Being able to get them to a great place where they understand that, okay, it is a mountain, an obstacle, and then they just need to be brave and they get it. Without we don't do things that go past certain comfortabilities unless we have different comfort level or comfort options for that. But yeah, that's really what stands out for me. Those kids that they come in, they're anxious, they barely even want to come through the door, and they end up leaving like, okay, I could do this, I did this, and they're proud of themselves. That's really what I want to get them to be, proud of themselves. I'm proud of them regardless, but just getting them proud of themselves.
And again, I think your practice always have done that. I mean, the you got to get them to a comfortable level, right? Because
Exactly.
as I was growing up, it's like, I didn't like going to this. I mean, I'll be honest, right?
Yeah,
So,
yeah.
it was tough, but I think, it goes to without saying that things has changed. I mean, your practice. I mean, and I've said this a couple times already, but you really provide that level of service, of understanding what the kids. Every kid is different, right?
Yes.
And then we gotta love the kids, and you gotta provide a service. So, in talking to you, you recently attended a conference, a National Dental Association convention. How was that experience? How was that? Do you go every year, or what? Tell me about that.
Actually, that it was very inspirational. We don't always go every year. This particular year, we were invited to speak, and it was very exciting for us because for many years we've been trying to get people to become more aware about childhood and infancy and how important it is to have the growth of your face and your jaws be optimal. Because what we have learned now is that how well you breathe and how well you sleep way into adulthood starts with how well your jaw grew. And who knew that? And all of that starts from infancy, from breastfeeding. It's not something that we're taught in school, but that's something that I personally, or we personally as a practice, have taken great lengths to study about. So we have a lot of advanced certifications on that. So being able to share that with other colleagues around the country at that convention in Las Vegas was very inspirational because now they go back and they'll never look at the kids they see the same way again, or even their adult patients. They come in with their mouth open, or they have TMJ or TMD issues, or their crowns are always breaking down, they're grinding their teeth, they're clenching, they're snoring. All of those started as infants. And so the idea that you can understand that if you're aware of that you're able to prevent that and again help the children to become their God-given best selves. So
I love that. I love that. I guess along those lines, I mean, I think you do a lot of community engagement, and which is a big part of your practice. How does being involved in the community affect your business and your personal lives?
Well, I mean, it's extremely important being in this community, which we've been for over 20 years, helping so many kids, and also offering. We've done programs where we've offered free dentistry, but on top of that, for us, what we're seeing is being a part of the we're part of the VDA, so being the Virginia Dental
Okay.
Association, in the executive committee. So being a part of, just lobbying, which we did in Richmond, and being able to talk to our local officials to help them see that things like insurance need to kind of do a better job with prevention and helping kids and helping cover services that deal more with prevention versus just covering services that are reactionary. So for us, that's been a big, at least for me, I'm definitely heavily involved in that organized part of dentistry to make changes in a more legal capacity or more executive capacity, so that way more people can understand that the insurance company needs to work for their patients and things like that. So yeah, community and being a part of it is extremely important to us.
Um, One of the things I know that in speaking with both of you is we talk a little bit about sleep apnea, right? And I think perhaps that's one of the things you talked at the convention.
Mm-hmm.
It's a significant issue that affects kids, adults, and can you explain a little bit of what that is, and then how it affects the overall health of everyone?
You want to take that?
Yeah, sure. I'll start off, but you're the mad scientist. That's how I got into it. So, no, I'm actually really grateful because as a pediatric dentist, I'm knowing that we affect growth and development of the face, the head, and neck. That's something that we didn't put the pieces together in dental school as providers, and so coming out and being under the tutelage of my mom. I was able to even make dentistry more rewarding to me.
Sure.
Okay, and so what in 2017, the ADA, which is our governing body, said that dentists need to be looking at sleep. 2017, dentists need to be screening for sleep, and if they can treat as early as possible, start treating. That rang true for us. Because Dr. Lynda has a backstory to it, which she'll talk about. But once we started seeing that, okay, we affect change early on, and being able to help children sleep better, and knowing that the way that their face grows affects the way that they sleep, breathe, grow, and how their brain develops. We started to really hit the ground running with education and getting ourselves equipped to be able to take care of our patients in that way. But I'll let Dr. Lynda talk about her story, and so then I can we can volley and talk
I
more
love
about
it.
it.
I love
Yes.
it.
Well, anyway, to answer that question and back on my backstory, sleep apnea is a condition where you stop breathing for moments at a time in your sleep. And it's important to know that it's actually like an end stage disease, much like stage 4 cancer. The stage 1 part of it is starting the mouth breathing, snoring, teeth grinding, clenching, just not focusing, not paying attention, things like that, because those affect how your oxygenation to your brain will start. And so it was 2008. I had gone to Miami to celebrate my birthday, and I could not stay for the party because I was sick. It was what we thought was bronchitis. We left the party, and I did not recover. I was more continually feeling fatigued, severe migraines. My reflux was worsening, and I had brain fog. I was really scared. I was scared for my practice, for my family. I was going from doctor to doctor. Nobody could really tell what was wrong with me. I was being treated for Lyme disease. And I knew I didn't have Lyme disease. The only lawn I crossed was like, I'm just going to my car. So I didn't meet the tick anywhere. And the fifth doctor took one look in my mouth and she said, "Oh, you must have sleep apnea." I kind of go, I'm a dentist. I would know if something in the mouth tells you have a sleep apnea. However, she sent me for a sleep test, and she was right. And I had moderate sleep apnea. My symptoms seemed like it was severe. And so I got on a CPAP, which is a machine, a mask that you put over your face to go to sleep. You know, imagine looking sexy during the day and then going to bed looking like Darth Vader, right? So that was my life for 7 years. And, once I got on the CPAP, I felt better. It was like night and day. My energy came back and I was like myself again. 7 years later, the symptoms started coming back. And so now, what now? So, and obviously, down on me, we treated the symptoms. We never treated why I was having the sleep issues. And my option at that time was to get my jaws broken. And, you have to break your jaws to make room for your tongue. And I was like, no, thank you. So I was starting to look for options for myself on how to feel well again. And it was at that time, it started coming back and going like, conferences and symposiums and more training. And the more you heard it, it was like, oh, how well your face grows, determining how well you breathe and your tongue and all of that. And I tell you, I was doing orthodontics before that time, like traditional orthodontics before that time. And after I was learning all these things, I'm like, oh my God. So we were just straightening teeth. We weren't really thinking about a good foundation for those teeth to be in. And with doing that, we didn't have room for the tongue. And when you don't have room for the tongue, when you lay back, it falls back toward your throat. And that's part of how you stop breathing in your sleep. And so that changed our whole paradigm because we see babies as young as 2 days old for breastfeeding support. And so the symptoms are there when they're younger, or from infancy, you can tell. And I looked at photos of me at 9 months of age, and a lot of the signs were there. I had the torticollis, which is like your neck twisting to one side, preference to one side. My fists were clenched like this, like there's a lot of tension in my body. My mouth was open, which meant I was breathing through my mouth. And my mom said I was inconsolable as a baby. So she was having difficulty nursing, but she didn't know why. But you had to feed your baby. And some moms, even they're having pain, they just don't equate it to anything that could be wrong with their baby. They just want to feed their baby. But these things are important. Breastfeeding should never hurt. If their breastfeeding becomes painful, they should definitely seek help. So so that sleep apnea, it is that end stage, like I said, but it's totally preventable.
Thank you so much for tuning in into the Everything But Real Estate podcast. Dr. Lynda and Krystal, tell us where we can find you online.
Definitely follow us on our Instagram. We have a ton of great information. Our Instagram is Ashburn Children's Dentistry, and our website is www.kidsmile.com. Lots of information there. We're happy to answer any questions you may have.
And they're here in Ashburn, Virginia. So visit them. They're an amazing group. And if you enjoyed this episode, make sure you subscribe to us and rate and review us and on your favorite podcast platform. Thanks so much for watching, and see you next time.